I think that our mental health system is in a mess now, and I'm afraid that with DSM V it will get even worse. People who are essentially normal are being diagnosed with mental disorders they don't have and being treated with potentially harmful medication they don't need. Small changes in the diagnostic system can result in tens of millions of people who were normal the day before suddenly qualifying for a diagnosis. And DSM V has made many of these changes, I think, quite recklessly, without careful and independent scientific review, and without a concern about the possible risks involved, focusing only on benefits. I myself would qualify for a number of the DSM V disorders. When my wife died 5 years ago, I felt sad, I lost interest, I couldn't sleep as well, my appetite was more than usual, and I felt much energy, it was hard to work. In DSM V, those symptoms, typical symptoms of everyday grief, would be called major depressive disorder after just 2 weeks. And that wasn't major, it wasn't depressive, it wasn't a disorder. When you love someone and you lose them, that's just grief and sadness. Another very important change in DSM V is the huge expansion of a category called somatic symptom disorder. If you have a medical illness and you're worried about it, that becomes a mental disorder. This would qualify 1/4 of cancer, heart disease, and diabetes patients for a mental disorder because they're worried about their illness. Normality is impossible to define. It's a cultural concept rather than a medical one. And originally, there were only 6 diagnoses, and now there are about 200. Our society is already immersed in pill popping. 1 out of every 5 adults takes medication every day. 6% of the population is addicted to psychotropic medications. The sales of antipsychotics are $18 billion a year, amongst the highest of all classes of drugs. The sales of antidepressants, $12 billion a year. Stimulants, $7 billion a year. I think that from the point of view of clinicians, it's important to be cautious in your diagnoses. Don't jump to conclusions. Don't make fancy diagnoses after a brief initial contact with patients. If you're a patient or a family member, what should you do? Don't stop your medicine. Don't go alone, because you may be in the category of people who really need it. The very clear thing that's happening now is the people who are most needing treatment aren't getting it, and the people who least need it are getting too much of it. And you need to figure out where you are in that continuum and make sure that the treatment that you get is tailored to your needs. Second opinions and third opinions are enormously valuable. I think people shouldn't make dramatic changes in their medication or other aspects of their life without consulting a clinician if you're already in treatment. But I think on the other hand, it's important that we not continue this practice of overdiagnosis and overtreatment for people who don't need it, and that we really need to focus our attention on those people who do.